Okay, let's dive into this. Welcome to today's Explainer, where we're looking at a pretty massive shift in men's health. For decades, the standard approach to erectile dysfunction has basically been a band-aid. You take a pill an hour before you need it, right? But today, we're exploring the science behind a totally different approach, regenerative treatments. Instead of just temporarily boosting blood flow for a few hours, these therapies are actually aiming to tackle the root pathophysiology of ED. We're talking about literally repairing the body's natural function.
So, here is our roadmap for today. First up, beyond traditional treatments. Second, we'll unpack shockwave therapy. Third, the P-shot. Fourth, maximizing results. And finally, we'll wrap up with the reality check. Let's get to it.
Section 1. Beyond traditional treatments, treating the root cause. To really grasp these new therapies, we kind of have to officially move away from those band-aid solutions I just mentioned. Look, standard oral meds like Viagra or Cialis, they're highly effective at treating the symptoms. There's no denying that. But they don't actually fix the underlying problem, do they? So unlike those standard meds, the whole goal of the synergistic toolbox we're examining today is to treat the pathophysiology itself. And that means directly targeting the actual disease process, the degraded blood vessels, the built-up scar tissue, so we can actually rebuild the body's natural function from the ground up. Moving right along to Section 2, Shockwave Therapy, the foundational tool. Think of this as the absolute foundational tool in our regenerative toolbox. This sets the physiological stage for all the healing that follows. So, what exactly is it? Well, shockwave therapy, medically referred to as acoustic wave therapy, uses high-energy sound waves to actively stimulate tissue regeneration. You might have actually heard radio ads or seen print ads for this recently under commercial brand names like Gainswave or TruePulse. Those are essentially just different brand names for the exact same core technology. Let's move to and see how this builds actual physical healing right inside the body. Now, while the complete exact mechanism is still being studied, clinical experts point to this incredible 5-step biological chain reaction. First, the shockwave energy applies negative pressure into the tissue. Second, that pressure creates a healthy kind of stress on the cell membranes. Third, that cellular stress triggers a big increase in your body's growth factors. Fourth, those growth factors recruit stem cells straight to the area. And finally, step 5, and this is the amazing part, this whole process results in the formation of brand new penile arteries. It literally builds new blood vessels from the inside out. All right, let's talk logistics. What's it actually like? Clinical protocols generally require somewhere between 6 to 12 sessions, just depending on how severe the condition is, and each session only takes about 10 minutes. Now, is it painful? Well, it can be a little uncomfortable, but patients typically apply a lidocaine numbing cream about 45 minutes beforehand, which makes the whole thing highly tolerable. Plus, there are 0 long-term side effects reported. So the crucial point is that after this relatively brief treatment window, studies show those regenerative results can last anywhere from 1 to 2 full years. That is a real game changer. Up next, Section 3, the P-shot, the biological booster. This brings us to the second tool in our regenerative toolbox, acting as a massive biological booster. The P-shot relies on something called platelet-rich plasma, or PRP. Basically, this is a super concentration of your very own blood. Here's how it works. A clinic draws your blood, spins it down in a centrifuge, and isolates the plasma. And this plasma is absolutely packed with your body's natural growth factors, stem cells, and cytokines. When it gets injected, this specialized plasma actively works to regenerate tissue and break down that stubborn, inhibiting scar tissue. It's literally the science of isolating the healing properties from your own body and delivering them exactly where they're needed most. But here's a really fascinating medical mystery that clinics hear all the time. A patient will come in and say, "Hey, I did the P-shot, but it didn't really work for me. Why?" Well, this is where we need to pivot a bit, because these treatments, they absolutely shouldn't be treated as isolated magic bullets. Which brings us perfectly to Section 4, maximizing results, synergy, and quality. The truth is, successful regenerative treatment relies heavily on synergy, meaning combining these therapies correctly and demanding top-tier medical quality. If you just go and get a P-shot by itself, it very often fails to deliver optimal results. Why is that? Well, because over the years, plaque builds up in your blood vessels, severely restricting that blood flow. You literally have a physical roadblock in the way. You have to use acoustic wave therapy first to break up and clear out that plaque. Only once that pathway is completely clear should you introduce the P-shot to boost the tissue regeneration. That synergy, doing both in the right order, is what creates real, lasting success. Now, what's really interesting about this quote here is that it's a stark warning about treatment quality. This actually comes directly from a medical provider describing their very own experience receiving PRP injections that were prepared using cheap, low quality kits. They vividly described it as feeling like someone was literally hammering a nail into their head with every single injection. Yikes, right? And that brings us to a massively vital point. Kit quality matters. The quality of the kit that a clinic uses to isolate your plasma has a huge impact on your outcome. Premium, high-quality kits yield the absolute best biological results and are virtually pain-free. Cheaper kits, as we just heard, can cause severe pain and completely fail to give you the clinical results you're actually looking for. Now sure, premium kits carry a higher premium cost, but listen, if you're shopping around for a bargain bin deal on a P-shot, you are very likely setting yourself up for an incredibly painful experience with really subpar outcomes.
Finally, let's dive into Section 5, the reality check. Are you a candidate?
Let's neutrally assess exactly who biologically benefits from this toolbox, and just as importantly, who doesn't. Looking at Dr. Chan's clinical guidance, there's a pretty clear divide. Good candidates are men who actually respond well to pills like Viagra, but absolutely hate the side effects and want to get off them. It's also really worth trying for men who have completely failed traditional pills and are even failing advanced penile injections like Trimax before they jump to something as drastic as a surgical implant. On the flip side, poor candidates include men with Peyronie's disease, which involves severe penile curvature. While experts initially hoped shockwave therapy could break up that dense scar tissue and straighten things out, it simply hasn't proven effective for that. Similarly, men suffering from ED due to a radical prostatectomy for prostate cancer are generally poor candidates. In those specific cases, the ED is caused by severed or injured nerves from the surgery itself, and unfortunately, shockwave therapy only shows a tiny, clinically insignificant improvement there. But here's the real kicker. Even if you are a perfect candidate on paper, your daily lifestyle choices completely dictate the success or failure of regenerative medicine. You can't just ignore your health and expect miracles. The absolute foundation of success requires controlled diabetes, normal blood pressure, optimized hormones, and no smoking. Period. And this brilliantly illustrates exactly why. When a clinic spins the blood of a healthy patient, the resulting platelet-rich plasma looks like clear, beautiful gold apple juice. But when they spin the blood of a patient with uncontrolled diabetes, the plasma literally looks like a thick, pink, frothy milkshake. This visceral comparison is just so vital to understand. That pink, frothy milkshake, that is what is feeding your organs right now. It is your blood flow. Uncontrolled lifestyle factors actively ruin the natural healing properties of your blood. So I'll leave you with this final, provocative thought to take away from today's explainer. How do you expect your body to regenerate tissue and successfully rebuild blood vessels if you're feeding it a milkshake? Regenerative medicine offers an incredible, synergistic toolbox to tackle the root cause of ED. But at the end of the day, the most powerful tool in that entire box is the foundational health you bring to the table. Thanks for joining me, and